Today, we're going to talk about utilizing STRAVIX PL on an open wound with exposed tendon, capsule, or bone. And in this case, we have a lateral foot wound. Patient had an incision and drainage. Now we are looking at healthier tissue. We're going to apply a STRAVIX onto this area. The wound itself has already been measured to be 3 by 4 centimeters. We have a 3 by 6 STRAVIX that has already been reconstituted, and we want to see the smooth side versus the side with the ridges. In this case, this is the side with the ridges, which is the Wharton's jelly and the amniotic artery and vein, and that's going to go onto the wound down like this. So the two ways you can apply this, you can either cut it in advance and then apply it into the wound, or you can apply most of it and then just trim as you need. Additionally, if you're going to use negative pressure wound therapy, or if you anticipate a lot of drainage or seroma formation, then you can consider fenestrating it. You can fenestrate before you apply it, or you can fenestrate once it's on the wound. I'm going to demonstrate fenestration in advance so that you can then just apply and suture the graft into the wound. So we said it's approximately a 3 by 4 size wound. So we know it's a 3 by 6. It makes it easy because it's 3. And then we just have to get the 4 centimeters here. So as you trim your piece down to the 3 by 4 based on the size of the wound, you have your assistant grab and hold and provide some tension. Make sure you can easily cut the graft. And we'll just leave this off to the side just in case we need it. Thank you. And then we're going to take this piece, and as I said, you can fenestrate it now. So I'll just sit here and I'll fenestrate with it on here. This way I'm pushing into the plastic and I don't have to worry about fenestrating into deeper structures. This can be meshed as well if you needed to. And once we have it, we have our Wharton's jelly side. This is the side that's going to go down onto the wound. And so when you lay it into the wound, the Wharton's jelly side is facing inside the wound itself. And you get it approximately where you want it to be. I personally like to tack it underneath the skin rather than going up and over the skin. Here we have our assistant holding the STRAVIX within the wound so it doesn't slip around. And what you're going to do is you're going to suture through the STRAVIX into the skin. And the suture is really your choice. I tend to use a chromic because it dissolves quickly. You can use any kind of absorbable, or if you like to go back in and take out the sutures later, you can use just a regular monofilament, non-absorbable suture. So this will at least get it tacked into place. And then what we'll do is once we have it in place, we can do the other side. And we know it's already fenestrated. So that's nice, so we don't have to worry about it doing that now. And here's our muscle that's exposed. So we're going to lay it here, we're going to lay it here, like that. So let's get this piece tacked in. Again, if you're working on the lateral aspect of the foot or the plantar aspect of the foot, you want to be really good about having your assistant hold that. You don't want that thing sliding down and sliding off the foot. Not everybody is as cooperative as this patient. And you want enough suture to tack it down, but you don't need a suture every single millimeter of the graft. So let's go, it's going to go here. And you can see as we start to suture it, it doesn't move around as much. Okay. And if you want to use more than one piece, let's say you have a very large wound, you can use 2 pieces side by side, you suture them together, and then I would suture them down to the deep tissue just to prevent them from floating up as well. And then once you have everything in here, your choice of dressing can be anything from a non-adherent dressing to negative pressure wound therapy. If you're going to do negative pressure wound therapy, you also make sure you put a non-adherent layer. Just avoid any silver containing products and avoid any cytotoxic products as well while you're doing the dressings. So if you're going to use negative pressure wound therapy, I would definitely fenestrate. And as you can see, it's coming together nicely, laying in place. And really your choice of suturing from the wound into the skin or the skin into the wound, we say ship to shore. Either way, as long as the graft stays where you want it to. And we're almost done. You can see my little fenestration line there where I stretched it. The nice thing about fenestration also, besides avoiding seroma and having it lift up, is it can also stretch your graft a little bit more, so you can get a little bit more out of it if you need to. Similar to a split thickness skin graft. All right, we're almost done suturing that on there. You can see our muscle is covered, our deep fascia is covered. So sometimes you come back at 1 and 2 weeks and you don't see the graft at all. I find I see that with patients with a lot of edema. And then sometimes the STRAVIX will turn brown. And that's not abnormal, that's not eschar that needs to be removed, that's the blood supply coming up in to the graft itself. And the pigment is actually the blood that you see. It's not that the graft is necrotic. So don't debride that part off. All right, so you can see that's the appropriate size. We have a little bit of redundancy here that we can trim or you can leave, and you can see it's slightly elevated from the surface. In this case, what we're going to do is we're going to suture deep just to hold the graft down also. And again, these are absorbable sutures, so we don't have to worry about trying to remove these at a later date. You wouldn't want to put a staple deep inside there. It'd be hard to take out. And you can see now it sets down nicely within the wound itself. And then if you don't like the idea of extra tissue, then you can just remove the redundancy here. And as I mentioned, you can have it underneath the skin edge. You can have it over the edge, just depending on how you prefer to place it.